All right, well, let's look at it. Allergic reactions. Everybody is allergic to something. You may not know it yet, but everybody's allergic to something. Everybody's allergic to grass. It's just to certain different degrees. Okay? You can work into an allergy, like I did with my cat. Never been allergic to cats. Got a cat and developed an allergy to it. Now I'm just waiting for it to die so I can take one less allergy pill. So the other myths about allergies is that it's not passed down through generations. So if your mom or dad is allergic to bee stings, that seems like a popular thing. For peanuts, that doesn't mean that you are. And the other myth is that it takes a introduction to what's called an antigen, or let's use the bee because that's the most common. The little bee stings you, and the first time that you've ever been stung by a bee, you're not going to have an allergic reaction to that. The bee stings you, and it introduces an antigen into your body, and then your body produces antibodies to sort of kill it, right? The second time the little bee stings you, you could develop an allergy if your body doesn't build up enough antibodies. So it's sort of an immune response, and there's different levels of allergic reactions. Now, I break it down, and this is my breakdown too, because this is the way I can understand it a little bit easier. You have mild or local allergic reactions, moderate, where you get shortness of breath, and then severe, where you have a drop in your blood pressure. This, when it drops in blood pressure, is called anaphylactic shock. You just take the S off and put a C there, anaphylactic shock. And it's the most severe, it's life-threatening. And most people who are allergic to peanuts or bees or things like that are highly allergic to them, they can go into anaphylactic shock within just a few minutes. You have to reverse this allergic reaction within just a very few minutes. Anybody allergic to anything? Huh?
No, not me.
No?
Bees.
Bees?
Strawberries.
Strawberries?
My skin's allergic to some metals, like I'll start getting rashes around those areas.
Sulfur drinks.
Okay. So, all you guys, who said bees? You carry an EpiPen? So you don't have a big allergic reaction to it. You get where you short of breath, tongue swells. Huh?
It doesn't swell, but I get
Short of breath. Alright. So all these on different levels of these allergic reactions. So this is what we're going to break down, and I'm going to show you this EpiPen in a few minutes, and we're going to talk about epinephrine. But let's look at this. Let me see if I can figure out how to draw. Let's do this. So you have a local allergic reaction. So let's say this is your hand. I'm sure that you'll be able to figure this out from the drawing. Let's go with hand.
Are we a seal?
Oh, that was flip. Oh, I thought that was foot. Yeah.
It's a whale.
But that's missing a
It's a little
toe.
flip. It's a little flip.
Missing a finger.
That's the little bee coming at you. And it stings you. Okay, so you get this sting right here. Most people, actually all people, get stung by an insect like that. They get a redness and some swelling in that area. If you're having sort of a mild or local reaction to it, and you can have allergic reactions to just almost anything. Different soaps, you can change soaps. That's happened to me before, where it's widespread. You get all red everywhere, but it's still local. It's still really considered a local reaction. Just a laundry list of things that you can come in contact with. You can come in contact with something that's just, I don't know, like you say, a substance or something, and break out into a little local reaction. But when we say local reaction, what we're talking about is, let's say the bee stings you there, and it gets all red, and it starts to get red around here and starts to swell a little bit, but it doesn't go anywhere. it stays right there on your hand. It doesn't start to streak. When a reaction starts to streak, like if this one was to start to streak up parallel to the veins, that's a problem, because that means it went systemic and it's in your bloodstream. And so you do need treatment there where this bee stings and all of a sudden it starts to streak. That's a problem, even in a local reaction. So we look at this and it's just redness there and you get some swelling. So it's this local mild allergic reaction. What you need to do with this particular one is just to go to the store, if you don't already have some, get some Benadryl cream and rub some Benadryl cream on it. And then it will go away. It's just sort of a small, localized reaction. It's no big deal. You can get it from anything, really. Just some inflammation of the dermis. Man, I don't get into that. Some other guy was talking about mayonnaise last year, and I don't know about garlic. I stick to Benadryl cream because Benadryl, we all familiar with Benadryl. Huh? Yeah, it does make you sleepy. It's an antihistamine. So you rub some Benadryl cream on it, and it starts to go away. What I would do as well is take an ink pen and sort of mark the borders of it, like that. And that way you know if it starts to grow. If you sort of mark the borders of that, just make sure it's not growing, it's not spreading. Okay? But Benadryl, on this local reaction, this mild reaction, Benadryl cream will usually take care of it. If it continues to sort of swell, you might get some hydrocortisone cream. It's a little steroid that you can put on there, and it will reduce the swelling in it for you. See if I can do this. I think I had it. Good. So Benadryl, do you know what? YL, something like that. Benadryl. I think there's another E in there, right? Perhaps. Okay. But Benadryl, it's a histamine blocker. You can see that even on the commercials it says it blocks histamine. And what happens is we have a lot of different types of histamine in the body. And I don't know which histamine this would be. But the histamine is what causes, that's an H. Histamine is what causes all the bad reactions. Even in a mild reaction. When I get allergic to get too close to my cat, my eyes start to itch and water a little bit. And if I don't correct that, I don't keep kitty away and put some eye drops in there, my nose will start to run, I might start sneezing a little bit. Everybody's had that, right? And so that is release of histamine, essentially. We won't go any further than that. It releases these mast cells, which causes the runny eyes and watery nose. But we'll just call it that release of histamine right now. There's a few more steps that we don't really need to get into. Just know that this histamine is released in the body. And just like any receptor site, it's looking for this histamine receptor site right there. Now, at this point in time, nothing's really taken place. I've had the allergic reaction. I kicked the cat away, and I feel the release of histamine because the itch in my eyes. Everybody has a little different notice. A different sign that comes up or symptom that comes up that they know they're about to have a little allergic reaction. Mine is at the bridge of my nose, it starts to sort of itch inside, right in here, and then my eye starts itching. So I know then I have to get away from whatever it is. I'm about to release some histamine. So I release the histamine, and in the bloodstream, and now it's looking for these histamine receptor sites. And what this is going to do, it's going to bind in here and fit in there. And once it fits into that receptor site, that's when all the bad side effects comes. That's when the watery eyes, runny nose starts to take place. Okay? Benadryl blocks that. It doesn't block the release of histamine, but Benadryl blocks this receptor site. So chemically, it puts a little shield over there so this histamine can't get in. If it can't get in, then it just dissolves, reabsorbs, and no side effects. Now, one problem with Benadryl, like you've mentioned, is the sleepy pill. When we go to Walmart and the pharmacy next semester and look at some over-the-counter medications, you'll notice a lot of the very expensive sleep medicine, all it is Benadryl, diphenhydramine. You know, you take a Benadryl, most people are going to go to sleep. If you have ADHD, you're not going to go to sleep. You're going to climb up the walls. So that's how I guess you can figure out if you have that. If you don't already know, you take a Benadryl, you don't get sleepy, and you start get really hyperactive, then you probably have another deficiency somewhere. Okay, but that's Benadryl, and it sort of blocks that off. Benadryl and epinephrine combined is what most people take for allergic reaction. Did I spell that right, Ben? Is there an E there?
Is that right?
That's right.
B, and
I can read it.
Huh?
What was it?
Benadryl. There's got to be a connecting vowel there.
Yeah.
Okay, well, you know what I mean. Huh? Yeah.
I never use it.
And then the other form, diphenhydramine, but we'll worry about that. So that's in a localized reaction, no big deal when we start looking at that. When we look at a moderate reaction, let's say that you got stung by this bee. Now you have this sort of, you're going to get the local reaction, sort of swelling, maybe that's spreading, okay? And you start looking at that going, wow, that's sort of spreading. I might want to take some Benadryl. But in a moderate reaction, you're going to get bronchoconstriction, which is going to produce what? Shortness of breath and what kind of sound? Wheezing. Good. You're going to produce a wheeze. And so when you can consider it moderate, and also when you get the shortness of breath and you start wheezing, that's when you need the epinephrine, because you need other treatment than what you can get over the counter. Now, people with severe reactions, they carry this EpiPen around because they know if they get stung by a bee and they have the sensitivity to bee stings, that they only have a few minutes to get their medications on board, or bad things are going to happen to them. So a moderate reaction is just characterized by shortness of breath, you start wheezing, you feel your throat closing off, tongue may start to swell, all right? And you know that treatment, you've got to get some treatment at that point in time. And then if you don't treat this, it's going to continue to progress, and then possibly, not all the time, but possibly you could have what we consider a severe allergic reaction or anaphylactic reaction, and that's where the blood pressure starts to drop. So and that's life-threatening, and you definitely need treatment at that point in time, because you get into this anaphylactic reaction. Like it says, very rapid in onset. There's people who get bee stings or maybe peanuts. Peanuts is a violent reaction too. And within 3 minutes, they're from normal to the brink of death. That's why they carry that EpiPen. Because if you don't carry your EpiPen and you have this kind of allergic reaction, we've already talked about it, time help gets to you, especially here, you could be almost dead. You'd be in very, very bad condition by the time an ambulance gets here, because the school can't give you any medication if you don't have your own, right? And most people, you don't carry an EpiPen? Nobody carries an EpiPen with them? Okay. People with these very severe reactions, you can't pry it out of their hands. They carry it around everywhere because they know that if they come across this a reaction, that it's life-threatening. So those are just the 3 categories when you fit in there. Any questions? questions there? Okay, let's talk about the medication right quick, because that's when we look at this. Epinephrine is the drug of choice besides Benadryl. Benadryl is going to, remember, stop or block the histamine receptor sites. Okay, so it's going to stop all the runny eyes, watery nose. Epinephrine is a beta drug. And that means, we talked about beta drugs, right, before. What's the other beta drug we talked about? No, not blocker, but beta. This is, I say the confusion. Beta drug, beta, these are beta properties. That means that they have these properties in them that don't cause something. No? Okay. No. Albuterol? Albuterol is a beta drug. It's going to do essentially almost the same thing epinephrine will do. Remember, we talked about the nebulized treatment? You can nebulize epinephrine if you want. It's not very common in adults. It's more common in children. But epinephrine's a beta drug, so it's going to cause bronchodilation. That's its primary thing. That's why you're taking it, because you have, in this moderate or severe allergic reaction, you're going to have bronchoconstriction, so you take epinephrine to bronchodilate. All right? Go back. The other thing that it does is vasoconstrict, and because of you want that property a little bit in case your blood pressure starts to drop in this allergic reaction, but primarily vasoconstriction and bronchodilation. The vasoconstriction is an alpha property. Anytime you hear that, this drug has an alpha property. It's going to vasoconstrict. The other thing that it's going to do, it's a beta-1 drug and beta-2 because of the bronchodilation. So beta-1 means, what's it going to do? Heart. It's going to do what to the heart? Huh? Yeah, increase. It's going to increase your heart rate, just like albuterol. It's going to bronchodilate, vasoconstrict. Not so much vasoconstriction from albuterol, but it's going to increase the heart rate. So you've got to weigh that to the back and forth. Epinephrine is a powerful drug. You got to be very careful with it, especially in the elderly, because they don't metabolize it as fast. Now it's given, the dose of that is 0.3 milligrams. And SQ stands for subcutaneous. A subcutaneous shot, you probably will see these in the hospital. What they will do, this subcutaneous tissue or fat. So this shot is going to go into the fatty part. So they don't give it the deltoid, they can give it in the thigh, anywhere where there's subcutaneous tissue really, but sometimes in the thigh or the deltoid. What they would do is they will, clean the side, draw up the medicine, pinch the side up, so get some fat up there, and then inject the medicine at a 45-degree angle. And I'll show you that in a few minutes. Not that we're going to practice that one, but subcutaneous. The other shots that you will see are like intramuscular. What's intramuscular mean? In the muscle. Right. Everybody's had that. You've had your hepatitis B, you've had IMs, or intramuscular shots. And there's a couple more, subdermal, just right underneath the dermis. When you got your TB shot, that was subdermal. They just poked it right underneath the skin, right? So the big thing about epinephrine is you need to get this in the body within 2 or 3 minutes after the allergic reaction. If you start having shortness of breath, or, the shortness of breath, it's the time to take it. Most people won't wait that long. They'll go ahead and take the epinephrine right away if they know that they have that reaction. Questions there? It's a very easy process to reverse. You just have to do it quickly when you do it. Oh, I don't want to go there yet. Let's talk about the EpiPen just for a minute. I'll show you later. You have all the EpiPens come in like this, and they're spring loaded. So, has anybody ever seen an EpiPen before?
No.
Have you used it?
No, but my friend had to bring it to work every day because she's highly allergic to grass.
Oh,
So she made me look at it.
yeah. And that's important. That's very important because of the fact that they might get into a little panic if they start using it. Very easy to use on these. The needle that comes out of this thing, okay, is it's fairly long because it's designed to go through pants. You don't have to find bare skin or clean the side or anything. It's a very emergent type drug. So what you would do is, I don't stick myself with this. Okay. You would remove the safety cap from the. Can I get a volunteer? You need to know how to do this because you're trained. Come on up. So, just like any medication, make sure it's epinephrine. Okay. Yeah, it's epi. Remove the safety cap. Let me borrow a thigh.
No. No.
The cool thing about it, I had some extra ones in that hard plastic sharps container. I shot one through there, and the needle went through that sharps container.
And you want to use my thigh?
So it won't have any problem going through those khakis. Here, it's
Let's
just
not.
it's just a small stick.
No.
It won't hurt.
No.
You're young. The epinephrine is good for you. You'll be awake the rest of the day. So you take.
Get away from me.
You volunteered.
I did not volunteer. You volunteered me.
You need to know how to do this.
Not on myself. Get away from me.
Don't be scared. Take one for the
I
team.
thought you meant I was going to stick you, which is why I came up here.
No. I'm going to stick you. I don't want to be stuck with this needle. Are you kidding? It's like this long. Come on here. You'll be okay. So, just be still. If you jerk, the needle's going to bend.
Oh.
All right? So you take.
No.
So much for my demo.
Sorry, guys.
Anthony, you're
Not
next.
today.
Oh, you're a man. You can take this.
Are you seriously gonna do
Yeah, come on up. You're a guy. You can take one for the team. Just don't look. Here,
that?
so
Right here. Got you, bro. Look at me.
put that in your mouth so you don't scream. So you take the epinephrine pen, all right? Make sure it's epinephrine. Hold still, don't jerk. And then just find a good open spot on the thigh and and then hold, man, you're tough. Then hold it for 10 seconds. Okay? Hold it for 10 seconds and then let it go.
Did you use no pen?
The trainer.
You know, that's
After you hit me in the back of the head the other day.
That's why wise.
I have to look real close. You notice me, I kept looking at the pen here
Making sure.
to make sure it's a, I kept looking to make sure it's a training device because this one
It's not.
is not
Do we have a volunteer?
a training device.
Let's shut off
You see how long the picture
This is real epinephrine. You would do the same, you would move the pen and inject it into the side like that. Hold it for 10 seconds and then remove it, okay? I almost made the error. It would have been a bad error in judgment. Well, I was doing the same thing, but I had the real one in my hand. And I'm going, I look at it like, oh crap, there's an expiration date on that. Oops, wrong container. They look the same. So they come in a little plastic container like this. Like you see, most people with these very volatile allergic reactions will carry one of these. Now here's the thing with this, is that, make sure I got the right one again, okay? I've had an EMT friend of mine that I trained, so I know she was a good EMT, allergic to bees. She got stung, and she knew the allergic reaction that she was going to take place, right? So what she did was, she removed the cap, did this, and it went in her thumb.
Oh my God.
Okay.
How long is that needle?
And,
Like
yeah, and she was a trained responder. So I'm saying this to tell you. Yeah, go ahead. Yeah. You can grab it. So she injected it into her finger, like so. Now,
Did it go through?
Did it work?
no. What do you think's gonna be the problem with her finger right here?
There's no blood vessel.
What?
There's no blood vessel. No.
Well, I mean, it goes into the fatty tissue, so it's still going to absorb, but what do you think happened to her finger? Think about the effects of of epinephrine. Restrict the vessel.
So does it
And it
shrink
shrink
Oh,
out.
she's beginning to get blood to her fingers.
Exactly. So when she showed up at the ER, her finger was almost black because the fact that the vasoconstriction, it vasoconstricted it so much that it wasn't getting any blood flow, so it wasn't getting any oxygen. So now, let's see how you think, and you guys know this, you've talked about this medication. What medication did they put on her finger? Huh? Yeah, they put something on her finger.
Yeah.
They had to restore that blood flow. What did they put on her finger?
Do the vasodilation, right?
Huh?
Something to get a vasodilation effect.
Right.
A heart, say heart. You ever see it in the heart check?
Isn't there one of
Mhm.
That little tube.
Yeah. What? You got it. What is it?
I don't know what it's called, but that thing right. Morphine?
Yeah, close enough. Nitro.
What? I said that first.
They put.
I said a second, yeah.
I just didn't hear you. They put nitroglycerin. They didn't grind up the pill and put on there. They put another form of nitro paste. I don't know if we talked about nitro paste, but you have nitroglycerin that's in the form of a paste that they put on the skin because the skin's don't absorb it, and so they put nitro there. It caused vasodilation and it restored blood flow to her thumb. Now I say all that and to say that even though, I mean, she was a trained responder, so you may have to help people with this. You know, I mean, like your friend there.
She might do the opposite.
Yeah, I mean, or they might just panic and not be able to stick themselves with it. You know.
She said she's like procedurally allergic to it.
Huh?
She's like procedurally allergic to it.
Yeah. So she doesn't leave home without that.
Like if they would have messed up like they missed or something, can you still give them some others? Can you like basically reload them on that?
No, it won't reload. They have to have another pen.
Oh, okay.
Once that's a good question. Once the needle comes out, the drug comes out. All right.
Also,
So there's only one.
like if they did like get a part of their finger was like that, can you get if you do have another one? Can you do it or?
Yeah, you do. Another
Okay.
part of the body would don't absorb better. Good question. Yeah, if you make a mistake or something, I'll pass the training device around so you guys can look at it. I don't want to be responsible for any accidental injections.
Or do it? Yeah, make sure it's. Good deal.
Now the other form of epinephrine, comes in this ampule. And you have a little ampule. You'll see these ampules in the hospital. This is 1 milligram of epinephrine, so you'd have to draw up the same amount or the right amount of epinephrine. And maybe we'll do this one day when we're bored. We'll break out the needles and teach you guys how to do shots, injections. It's pretty easy. Same as IVs. It's not that difficult. But you would draw up the medicine and then give it to her in an ampule. The other form, the way medication comes, is in a vial,
EIAL.
AL, yeah, vial. And the ampule, or the little glass one, is single dose. Even though there's more than one dose in here for epinephrine, because it's 1 milligram in here. The other ones are you can draw more out of, or multiple doses out of the vials instead of the ampules. Yes. Go ahead.
If you get to the scene and they are already seizing, do you give medicine or do you just like hold them until they stop seizing?
You treat them for seizures. Good question. If you get there and like your friend, if they're seizing, then you would treat them for a seizure first. All right. This is a vial of medication where you would just put the needle in here and then draw up. It's the same medication as here, just in this is 30 milligrams. This is 1 milligram. So as you start looking at the medications, I'll pass these around so you can see the difference on them. And then you would just, and we'll go through a shot class probably later where you're able to draw up the medication. Any questions on epinephrine?
It's for the shot thing. Not the vial, what's it called?
The ampule?